know that a disease once thought to be on the verge of elimination is now experiencing a global resurgence. Measles, one of the most contagious diseases in the world, is rising again in many countries despite the availability of a highly effective vaccine. So why is this happening? In this video, we'll explore the surprising reasons behind the resurgence of measles and its implications for global health. Hello everyone, and welcome back to the channel. If you're interested in global health, medicine, lifestyle, and public health education, make sure to subscribe, like this video, and share it with others so more people can learn about important health issues affecting our world. Today we'll discuss an important public health topic: why measles cases are rising again worldwide. In this video, we will cover what measles is, the global trend of measles resurgence, the main reasons measles cases are increasing worldwide, the public health implications, and strategies to prevent future outbreaks. Let's begin. Measles is a highly contagious viral disease caused by the measles virus, which belongs to the paramyxovirus family. The disease spreads mainly through coughing, sneezing, or direct contact with respiratory droplets from an infected person. According to the World Health Organization, measles is among the most contagious viral diseases known. An infected person can spread the virus 4 days before the rash appears and up to 4 days afterwards, making transmission extremely easy. Common symptoms of measles include high fever, persistent cough, runny nose, red or watery eyes, and a distinctive skin rash that spreads across the body. While many people recover, measles can also lead to serious complications, such as pneumonia, encephalitis, which is swelling of the brain, severe diarrhea, blindness, and in severe cases, death. Young children, especially those under 5 years old, and malnourished populations are particularly vulnerable. Fortunately, measles is preventable through vaccination, especially with the MMR vaccine, which protects against measles, mumps, and rubella. Although global measles deaths have declined significantly since the year 2000, recent years have seen a worrying increase in cases. Data from international health organizations show that outbreaks have been reported in many regions, including Europe, the Americas, Asia, and Africa. For example, reports from the Pan American Health Organization indicate that over 10,000 measles cases were recorded in the Americas in 2025 alone. Similarly, the World Health Organization has reported tens of thousands of cases across Europe and Central Asia in recent years. Some countries have even lost their measles-free status due to rising infections. These trends show that measles remains a serious global health concern. Why are measles cases rising? There are several major reasons for this resurgence. Let's examine them one by one. The most important reason for the resurgence of measles is declining vaccination coverage. Experts say that the measles vaccine is highly effective, but outbreaks occur when communities fail to achieve sufficient immunization levels. To prevent outbreaks, at least 95% of the population must receive 2 doses of the vaccine to create what is known as herd immunity. Unfortunately, many countries have vaccination rates below this threshold, allowing the virus to spread easily. In other words, the problem is not vaccine failure, it is failure to vaccinate enough people. Another major factor is vaccine hesitancy. Vaccine hesitancy refers to the delay, reluctance, or refusal to vaccinate despite vaccine availability. Several factors contribute to this problem, including misinformation on social media, distrust in public health institutions, and concerns about vaccine safety. Since the COVID-19 pandemic, skepticism toward vaccines has increased in some communities, which has further contributed to declining immunization rates. The COVID-19 pandemic also disrupted routine vaccination programs worldwide. Healthcare systems were overwhelmed, which resulted in missed childhood immunizations, delayed vaccination campaigns, and reduced access to healthcare services. As a result, millions of children missed their scheduled measles vaccinations, leaving large numbers of people vulnerable to infection. In today's interconnected world, diseases can travel quickly. Measles is extremely transmissible, and infected travelers can introduce the virus into communities with low vaccination coverage. According to the Centers for Disease Control and Prevention, measles outbreaks often occur when unvaccinated individuals travel internationally and bring the virus into vulnerable populations. In some regions, limited healthcare resources also contribute to measles outbreaks. Challenges include limited healthcare infrastructure, vaccine shortages, lack of trained healthcare workers, and difficulty reaching rural communities. These factors make it harder to maintain strong immunization programs. Even in countries with high national vaccination rates, outbreaks can still occur if certain communities have lower immunization coverage. Examples include isolated religious groups, migrant populations, or communities with limited healthcare access. When measles enters these communities, it can spread rapidly. The resurgence of measles has several important public health consequences. First, outbreaks place a heavy burden on healthcare systems, especially in developing countries. Second, measles can cause severe complications and death, particularly among children and immunocompromised individuals. Third, measles infection can weaken the immune system, making individuals more vulnerable to other diseases. Repeated outbreaks also threaten global efforts to eliminate measles entirely. To control the resurgence of measles, several strategies are essential. Strengthening vaccination programs. Countries must ensure that children receive 2 doses of the measles vaccine, and routine immunization programs should be strengthened. Addressing vaccine hesitancy. Governments and health organizations must combat misinformation through education campaigns and transparent communication. Improving disease surveillance. Better monitoring systems allow health authorities to detect outbreaks early and respond quickly. Global collaboration. International organizations such as the World Health Organization and UNICEF work together to support vaccination campaigns and disease monitoring around the world. In conclusion, measles cases are rising again worldwide due to several interconnected factors. These include declining vaccination rates, vaccine hesitancy, disruptions caused by the COVID-19 pandemic, international travel, weak healthcare systems, and clusters of unvaccinated populations. Although measles is extremely contagious, it is also one of the most preventable infectious diseases through vaccination. Maintaining high immunization coverage and strengthening healthcare systems are essential to protecting global health. If you found this video informative, please like the video, subscribe to the channel, and share it with others so more people can learn about important global health issues. And let me know in the comments. Do you think vaccine misinformation is one of the biggest challenges facing public health today? Thank you for watching.